Hi, I'm Jane Andrews. I'm a gastroenterologist and I'm a medical lead in the surgery program in Carlin. I'm here to talk to you today about the Carlin PreHab program, which is a really great new initiative which we've been running for about a year now. PreHab is the idea that instead of waiting to get better and have rehab after surgery, you do a lot of work on your own health before the surgery, so it's PreHab, which means that you'll turn up better for the surgery and you'll recover faster from your surgery. It means that people who do PreHab will have less complications, a shorter hospital stay and a better overall result. So it's a win all round. It's a win for you as a consumer, it's a win for the system because fewer bed days are used, and it's better because you'll get a much better long-term result from your surgery, particularly if it's joint surgery or hernia repair or anti-reflux surgery, because they're the sorts of things where PreHab really makes a huge difference longer term. This is a really interesting program because we've co-designed the whole program from beginning to end with a whole lot of different people. Consumers who've had surgery and had all different experiences that they'd rather not repeat or rather not have other consumers go through. We've also used a whole group of multi-professionals, so people from all the allied health professions, including physiotherapy, dietetics, occupational therapy, exercise physiology, psychology, just to name a few. We've also included GPs because they're the referring doctors often, and we've included specialists within the hospital. Not only surgeons, but also physicians like myself, because we're often the people who manage the medical problems that surgical patients have, which lead to their delays. So the whole thing has really brought together a great group of people to deliver the optimal holistic program. And it deals with physical as well as mental and practical social aspects of PreHab, like having the right devices at home beforehand, getting your mental health in order, addressing things like your emotional well-being and drug use and chronic pain, all of which can be neglected sometimes when we've got our eyes on the fact that we just need an operation. Because an operation on its own is not as good as the whole healthcare journey. Well, we talk about what are called modifiable risk factors. So a risk factor is something that makes you more likely to have a problem, and modifiable risk factors are things that you may be able to do something about. Now we know they're tricky things like weight loss, smoking cessation, better control of your diabetes and exercise, but actually the first stage of being able to deal with these things is knowing that it is a risk factor and understanding how people can help you modify that or how you can modify it yourself. Because most consumers are really clever people. You're an expert in your own health, and if we give you good information through our website and through the app, then you may well be able to do quite a lot of this yourself. We know a lot of people are referred to outpatients or referred to a surgeon in their rooms to get an opinion first as to, is surgery likely to help? Sometimes there can be a long wait before you even see the surgeon. And that's an ideal time for us to be able to give you the information that can help you start your own PreHab. It's a really interesting fact and something which we sometimes skip over, that actually even doing the PreHab for some people will mean that they no longer need the surgery, or that the surgery can be put off for some years. This is actually quite common for knee replacement surgery and even for hernias. So sometimes PreHab prevents or pushes back the need for surgery. Mostly though, it just means that you're going to turn up much better condition and have a much better surgical experience. And the longer before the surgery that you get to start embedding some of these things, the better your overall health. So there are health gains not just for your surgery, but for the rest of your life. And the more people can be aware of this and helped to do this for yourself or with resources in primary care, the more affordable hospital care will become, and the more people we will be able to offer elective surgery. And that's going to be a bonus for the whole community too.